Good morning, everyone, and welcome to our very special virtual event. My name is Sue Hunt, and it's my privilege to be the Chief Executive Officer of the Royal Children's Hospital Foundation. Can I begin by acknowledging the traditional owners of the lands on which we gather this morning here at the RCH, the Wurundjeri people of the Kulin Nation, and pay my respects to elders past, present and emerging. It's wonderful to see so many of you with us today. I know some people are joining us for the first time, and many of you have been with us on this journey of virtual events through the year. Whether you're first-timers or whether regulars, we're so grateful for your support, and we're really thrilled that you're with us. Well, it's been an exceptionally challenging year for all of our community, hasn't it? And we're so fortunate that you've stuck with us. We'd love to hear from you today, so please use the chat function and tell us your name wherever you're from. We're also going to be using live captioning, which you can view by clicking on the live transcript button in the menu bar below. These captions are automatically generated, so they may not be perfect, but we do hope they'll be helpful to some of you. And I'd like to welcome our presenter this morning, Jane Miller, Chief Operating Officer here at the RCH. Today, we're very fortunate to have Jane here to give us an exclusive insight into the impact of COVID-19 right here at the hospital. Jane's going to share with us how the hospital has adapted, the unprecedented challenges it's faced, and the unexpected opportunities that have arisen from the pandemic. And before I hand over to Jane, though, we'd love you to ask questions throughout today's presentation, and we'll take those at the end of the presentation. You can type them into using the chat function, and we will endeavour to answer them all in our Q&A later on. So now I'm delighted to introduce Jane Miller.
Thank you, Sue. And I'm delighted to be here to share some of the service transformations that we've made over this year, so many of which have been possible through the support of our community. I'd like to start by saying that 2020 was the year none of us expected. At RCH, we were preparing to celebrate our 150th birthday, 150 years of providing high-quality paediatric healthcare to sick children. Many events were prepared for a celebration, but also to foster relationships and partnerships to support us into the future. It's quite remarkable, though, how quickly things emerged in the context of COVID-19. The first case was reported in December 2019, and only 3 months later, in March 2020, the World Health Organization declared a pandemic. As we are acutely aware, the consequences have been significant, and there have been nearly 56 million cases across the world, and sadly, more than 1.3 million lives lost. The pandemic has altered all of our lives, including the life of the RCH. However, whilst it's not the year we expected, I am so proud of the details of to share the details of how the RCH has responded with the support of so many, including you. We have achieved a great deal, rethinking and reimagining the important services that we provide to young people and children from Victoria and beyond. We responded early. We weren't quite sure what we were dealing with. We didn't know what was coming, but we wanted to be on the front foot and we wanted to be prepared. As the Chief Operating Officer, I'm responsible for the day-to-day operations of the hospital. When emergency situations occur, I assume overall accountability for the incident response as the Hospital Incident Commander. In delivering this response, I am supported by the Hospital Incident Management Team. In late January, we convened our first meeting with a view to planning new systems, new services, to keep patients, families and staff safe, while continuing to innovate, collaborate and advocate in pursuit of delivering great care everywhere. There have been so many changes at the RCH. By March, our laboratory services team had stood up in-house COVID-19 testing, and we had started testing children and their families as well as staff for COVID-19 in our new respiratory infection clinic. Thankfully, COVID-19 is largely not a serious disease in children and young people. However, we worked to develop plans for managing surge, particularly in our critical care areas, and we sought to identify how we could help other hospitals, particularly those that provide adult and paediatric services, with a view that we may be able to assist them so that they could focus on providing treatment for adults with COVID-19. We implemented plans for service sustainability. Throughout the pandemic, we needed to look at altered service models, we needed to split teams into new rosters, we needed to increase our cleaning, and we remained focused on our business continuity so that we could continue to meet the needs of our patients and families. We implemented many processes to enhance our infection prevention and control services. We really wanted to focus on minimising the risk of transmission. We developed resources for staff, for our community, and we remained firmly focused on supporting our team so that they could continue to deliver important healthcare services in a safe environment. Many of our staff, both clinical and non-clinical, began working from home. Some of you may be familiar with our wonderful facility, which is now nearly 10 years old. But this year it has looked very different. We have restricted site access, we have health screening for staff and families, we have physical distancing in waiting areas, and our attractions like the Creature and the aquarium, which are very, very popular with children, were behind barriers. Only after a few weeks of planning, we opened the RCH Respiratory Infection Clinic in March. I have to say that the RIC, as we call it, is a result of amazing teamwork. It's teamwork at RCH at its best. Its success has been due to so many, from staff from general medicine, the emergency department, laboratory services, specialist clinics, infection prevention and control, communications, facilities and support services. We have swabbed over 20,000 patients across several settings, in the clinic, in the car park and on a small number of occasions out in the community, particularly supporting children with special needs and disabilities to be swabbed in a familiar environment. That photo at the bottom at Croxton School is the team out there recently doing some swabbing with the school dog, which is terrific. To date, the RIC has diagnosed 176 children and 85 adults with COVID-19. The vast majority of these children have not required hospital services and have been supported and monitored in the community. But the team hasn't just been focusing on delivering the services. They've also been looking at how they provide resources to others around swabbing children for COVID-19. Led by Shadan Tosef, they've developed this guidance around swabbing for COVID-19 in infants that's available to people who access our website and has been promoted by the Department of Health and Human Services. And they're also involved in a number of research projects to help us better understand COVID-19 in children. Telehealth. Our Department of Specialist Clinics and Ambulatory Services in general is a very busy service. On any given day, we would normally see around 1,200 patients a day. Within that, our telehealth has historically supported regional and rural patients and families. It's been overall a very small component of our ambulatory service. But in early March, we started planning to significantly increase the overall telehealth activity so that we could continue to connect with our patients and families and continue to provide them with treatment and care. In late March, we were delivering about 50% of our activity via telehealth, and in April, that was more than 60%. More than 10,000 appointments were delivered by telehealth in April. Our ability to pivot quickly was supported by our electronic medical record, which we implemented in 2014 and recently shared with the other Parkville precinct hospitals. And that implementation was supported by both the Victorian Government and the RCH Foundation. In the most recent second wave, we were delivering more than 14,000 appointments per month by telehealth, whether that was by video or telephone call. Depending on the clinical need and on the advice of our doctors, nurses and allied health professionals, we still do continue to provide some face-to-face consults in specialist clinics. in line with all the COVID-safe requirements. We've received very, very positive feedback about our telehealth service, and once we are through this pandemic, we are very hopeful that we will continue to maintain high levels of telehealth to support the connection of our patients to the hospital. It's been an interesting year. Some of our services have experienced much less in terms of activity, reduced elective surgery activity, reduced emergency department presentations, whilst other services have continued to have strong demand. Our paediatric ICU, our mental health services, our Children's Cancer Centre, and our hospital in the home service. We affectionately call our hospital in the home service Wallaby ward. So it's always been about providing services at home and minimising the disruption to patients and their families. But in COVID times, it's also been about keeping them safe and avoiding the need to visit hospital. We implemented a program for the assessment and monitoring of kids on non-invasive ventilation using equipment that purchased through the support of the RCH Foundation, thanks to the generosity of people like you. And in May, we introduced low-complexity intravenous chemotherapy for eligible patients in Wallaby. Previously, this was provided through our day cancer centre, but the teams now work together to deliver this in the home. We understand that this is the first service of its kind, paediatric intravenous chemotherapy for children in Australia. We've received, again, lots and lots of positive feedback. But rather than me talking about it, I'm actually going to share a short clip that was on the 7 News and actually get Ollie, who was one of our first patients, to talk to it.
For the first time in its history, the Royal Children's Hospital has begun treating tiny cancer patients in the comfort of their own homes. The new chemotherapy program has been fast-tracked because of the pandemic and is proving a success.
It's a home delivery of a very different kind.
Hi Mel, how are you? Come in.
Nurse Mel Cook is bringing hospital to Ollie Shaw's dining room. The 9-year-old has been dubbed Patient Zero, the first Australian child to receive vital chemotherapy treatment in the home.
Normal visits would take up 3/4 of a school day, and given Oliver's challenges with learning, that school time is precious.
Last October, scans revealed benign tumours on Ollie's brainstem and both optic nerves. He needs weekly chemotherapy to slow their growth and preserve his sight. Now the active Grade 4 student is spared the dreaded weekly trek to hospital.
Boring because we have to wait in the traffic.
Until now, chemotherapy for young patients was only ever given at the Royal Children's Hospital Cancer Centre.
We understand that it's the first at-home chemotherapy service for children in Australia, so we're pretty excited about it.
It's hoped up to 30 children a year will be eligible.
I think it's a wonderful initiative, keeping kids at home, getting the essential treatment that they need, but in their own space.
Giving busy young patients more time to focus on what's important. Jackie Quist, 7 News.
So that's just one of the things that we've done in terms of responding to COVID, and as you can see, a terrific outcome for Ollie and his family and all those that use that service. Now, the RCH National Child Health Poll has been supported by the RCH Foundation for many years, and it's a quarterly national survey of Australian households with a view to shedding light on big issues in contemporary child and adolescent health. It aims to inform national discourse, health priorities and policy formulation, and stimulate further research into new and emerging issues. Our poll outcomes have enormous reach. This year, the poll focused on COVID-19 and vaccinations. Data on the mental health impacts of COVID-19 pandemic on children was used to inform government decision-making about the safe return of school children to Victorian primary schools. The poll also identified that 1 in 5 children were not getting their vaccinations on time due to fears about getting COVID-19 in the health service. The data about delayed vaccination in the setting of COVID-19 was presented by poll director Dr. Anthea Rhodes at the Premier's press conference. It was also used to inform the development of our drive-through immunisation clinic for catch-up vaccinations. Commencing in August 2020, this is our drive-through immunisation vaccination clinic, with our immunisation nurses hard at work there. We've seen really steady demand for this service, and now with the prospect of a COVID-19 vaccine in 2021, we've commenced planning so that this approach could be used to support the rollout of this much-awaited vaccine. So, that's it from me for now, but I hope this has given you some insight into the RCH response to COVID-19 and the incredible work of the RCH team members who've really remained focused on doing what we do best, whilst keeping everyone safe. Thank you to all of you. We couldn't do it without you, and that is continue to lead in the delivery of paediatric healthcare. Thank you.
Thank you, Jane, so very, very much. We really appreciate you taking your time out of your really busy day to kind of share with our community of supporters the workings of the hospital. And I think, folks, you can see some of that is really the inner workings of the hospital. And Jane would never say this about herself, but, you know, Jane has been the driving force in almost every respect around the hospital's incident management control and its approach to COVID-19. So, Jane, we just know how busy you are, and we really seriously appreciate taking the time out. While I was listening to your presentation, it did occur to me, you know, that a couple of things. One, so much of what you talked about is supported by our community, which is, you know, fantastic. But also, you know, we hear a lot about our frontline healthcare workers. But there are many other frontline workers that we don't hear about so often. They're less visible, but they're no less essential to keeping the hospital running. And I think you've really given us some insight into that today as well. So thank you so much. I'm sure everybody's enjoyed Jane's insights, and we're going to come back to questions in just a few minutes. But sometimes lost in all the statistics we hear about COVID-19 are the individual stories, and stories about families' unique experiences. You heard that wonderful story from Channel 7, but as you know, many of our patients rely on the hospital for complex and ongoing care needs. And we'd like to share with you another experience today, another unique experience from one of our families who are incredibly inspirational, and that's the Miraglia family. And I don't think anyone's better placed to describe the impact of COVID-19 and the ongoing care responsibilities with the RCH. Luca has been an RCH patient since the moment he was born, and he is still with us today and will be with us for a long time to come. So thank you to the Miraglia family, who generously agreed to record their story via Zoom whilst visitor restrictions remain in place at the hospital. And we're going to show you that video now. So thank you.
Our relationship with the Royal Children's Hospital began just over 13 years ago. Rob and I were excited parents-to-be, expecting identical twin boys. On the 9th of July 2007, our world was basically tipped upside down. Luca's brother, Alessio, died just hours before they were born, and Luca was in a very, very low state and wasn't given much chance. He was just a few days old when he was transferred to the Royal Children's Hospital. We entrusted them with all of our hopes to save his life. We had some very, very dark moments during that time. And the one thing we had that whole time was the comfort in knowing that everything possible was being done for Luca. And when you're feeling helpless as a parent, that is very powerful. The amazing work of that team enabled Luca to stabilise. And finally, at 6 weeks, we were able to take him home. As a family, we've faced a lot of challenges.
Not only do we find ourselves in the middle of this pandemic, we're homeschooling. I find myself out of work. Luca's in need of a kidney. So from February this year, Luca and I were going through a workup through a preemptive transplant phase, with me being the donor. We were in the final stages of the workup when we received some heartbreaking news that I was no longer eligible due to a medical condition that I had some 20 years ago. And it was shattering, and it set us back quite a bit. But I have to say, the team at RCH were absolutely fantastic in the way they responded. Now, Luca's kidneys were at the end stage of failure. He needed to go directly into dialysis. The team quickly got us on the list, and a catheter was inserted ready to start peritoneal dialysis. We were in hospital for a couple of weeks, and during that time we started our training basically on how to manage dialysis at home, and there's quite a lot to learn. The dialysis team were absolutely fantastic with their training, and we knew we were in good hands. At home now, we manage Luca's treatment. We have a dedicated storage place for all the dialysis equipment, and we set up each night. And I guess COVID halted a little bit of the treatment, but it was absolutely sensational the way RCH responded to us. And I guess we're so happy that we've got them to back us up.
The care was never compromised, and COVID was in the background instead of being the other way around. So it's just been remarkable, really. What started as a way of saying thank you really began when we were in NICU, and we decided that one day we would do something to show our gratitude. We'd always taken for granted that the Children's Hospital is always there for us, that there's always going to be groundbreaking research, there's always going to be medical breakthroughs, they're always going to have the top surgeons. But the reality is that the government funding keeps the hospital functioning, it keeps it going, but it's the philanthropy and the community fundraising that brings it up to that gold level standard, and a standard that we've all come to expect and rely on. The funds that we raise go towards supporting the Royal Children's Hospital bed sponsorship program. Luca's very proud of his sponsorship of a bed in the NICU butterfly ward, where his journey began 13 years ago. Whenever we go into the hospital, we always check out the acknowledgement board, and Luca will always look out for the Miraglia Foundation. And it really, gives us a sense of honour and pride to see that up there. So in his 13 years, he's been a pretty regular visitor to the RCH, and there aren't many departments that he hasn't been involved with or who haven't treated him. There's nephrology, audiology, cardiology, immunology, gastroenterology, physio. The list goes on. And so from these beginnings, it's quite incredible to look back and see where he is now.
Hi, I'm Luca, and I'm 13 years old. I want to say thank you to the hospital, the doctors and nurses, and all of the helping people back home. When I was a baby, I was really, really sick. The doctors helped me get better so I could come home. Since then, I have been back to the hospital for appointments and treatments well over 100 times. I don't mind going into the hospital. Everyone is really nice to me, and I get to have time off school. I love seeing my kids around the RCH and being involved in the fundraising event so that I can help the hospital and other sick kids. I've had lots of challenges, but because of the excellent work the hospital does for me, I stay healthy and can do most things that other kids can do. This year, I got my black belt in Taekwondo. I passed my preliminary piano exam. I'm getting heaps better playing the drums, and last week I swam 50-metre butterfly. I would never been able to achieve all those things without the Royal Children's Hospital and all the supporters like you. Please keep supporting the Royal Children's Hospital so that it can keep making history and be one of the best kids' hospitals in the world. By doing that, you're helping kids like me to have the opportunity to be the best they can be. Together, we can do it.
What an incredible family. I'm sure you'll all agree, folks. I'm thrilled to say that certainly Lisa, I think Lisa and Rob might be both on the call today and joined us. But what an incredible young man Luca is. And for those of us who've been able to watch him grow up a little bit over the years, he's turning into such an incredible young man, and I'm sure you can be all really proud of him. And thank you so much for sharing that story with us. I'm sure every one of you is inspired by Luca's story, and if you haven't considered sponsoring a bed yet, that might be a great way to help continue Luca's story and Rob and Lisa's story as well. We're so grateful to the Miraglia family for everything that you do to support our hospital. Thank you so very much. I wanted to say hello from a few people who are on the call online with us. We've got 35 people online. And I'm delighted to say that Peter Yates, our chairman of the foundation, is here and says hi. We've got Emily Cormack from Equity Trustees, the lovely Robin Anderson, who's involved with our auxiliaries, is with us, and Shashi from Friends of the Children. Joanne Fitzgerald, Marcia Bacon, Ken and Jill Harrison, who are long-term supporters both of the auxiliaries and the hospital in general. And also online we've got the powerhouse Margaret Zeta from My Room, who's one of our incredible supporters in cancer. Stuart Tolliday, who's representing our Rats of Tobruk association, with whom we have a 11-year partnership. Carmel Brown and John and Trish Chirini, and I hope John and Trish are enjoying life on the island. I'll be back there with you soon. So welcome everyone. I'm sure there are other people. That's not 35 people, but those folk have taken the opportunity to type in. So now's our opportunity to ask Jane any questions that you may have. And Jane, while they're coming, we've got a few questions that are going to come through, I'm sure, but I'm going to kick off because it's my prerogative as host. Just to ask you a first question. So this must have been a very challenging and rewarding time in equal measure, perhaps, and to be able to provide leadership in the health sector. What was going on in your mind when you started hearing about COVID-19 and as it was emerging into a global health crisis?
So many things, Sue, actually. I think overarchingly the questions were around what are we dealing with here? We were relying heavily on our infectious diseases physicians and our infection prevention and control team to help us understand what was coming out of the data around how this virus was acting and what it was doing. But we were also trying to think through what are the operational impacts that this pandemic might have on us in terms of continuing to deliver services. And very early on, we were certainly looking at any supply chain vulnerabilities, how we're going to ensure we got the right PPE, but also the equipment and the consumables and the medications that are often so specialised in paediatric healthcare. How we were going to shore up that we could continue to get all of those resources. And then also thinking about our team. How did we support our team to get across what was happening? How did we give them guidance about what was going to need to happen and engage them in that journey? And as I said earlier, they just really have risen to the challenge across all departments in terms of working together to continue to deal with what has come. It's been ever changing really across the year. And the recent second wave had its challenges for all of us in lockdown, but in terms of then continuing to provide healthcare services.
Yeah, indeed. I'll never forget, you wonderful thing, amazing things that you did was you established the whole of campus group. So the hospital absolutely takes the lead in a situation like this, but you established that group when you brought together hospital, senior leadership of the hospital, the Murdoch Children's Research Institute, Department of Paediatrics and ourselves, and we're very kind to be involved in that, just to keep us briefed and updated. And I think I remember the day, it was interesting because it's this, even for us, for me as a CEO of the foundation, I was feeling, the pressure of what do we do and when do we do it and so on. And I think in some ways I thought, well, somebody will tell us what to do. Somebody will go, right, well, you need to go home or you need to, But I'll never forget the day when you had, I think it was possibly the first of those meetings, and you said to me, well, and so you'll be needing to make your decision about when you go home. And I don't know why, I don't know why that's so prevalent in my memory, but it is, because it was like, there was a moment at which I thought, oh, okay, yes, so we're all together, but we're all on our own. We've all got our own challenges and our own things that we need to do. So that was a tiny piece for me. We can only imagine, all of the things that each of the institutions did, but that you were running that response. So congratulations. So I guess that leads me to say, well, you've done an exceptional job, you and the hospital, and as you say, it's all teamwork. But what are you most proud of?
Look, I think it is the teamwork. As part of our compact at the RCH, which is our social contract around how we work together to deliver great care, we say we value the contribution of everyone in the delivery of that. And I just think it has been absolutely amazing to see everyone come together and work together. And it has required some coordination, in terms of what are we providing, how are we providing it, who needs to be involved in doing that, what services are we scaling up, what are we scaling down. It's been absolutely incredible that the team has just worked together, felt supported. We've communicated across the team and with our campus partners to keep everyone abreast of what we're doing, and I think it's been absolutely tremendous. Yeah.
I think it really shows, doesn't it, that beyond the healthcare response, beyond the obvious things, it shows that just how exceptionally this campus works. And there was never a shadow of a doubt who was taking the lead, but we all fell in behind it, and we keep those conversations going every week because there are new and emerging things all of the time, aren't we? So I've been incredibly honoured to kind of be part of it. I mean, it's the funny thing. I think we're at that stage, aren't we now? Maybe it's because we're coming out of lockdown, because the Victorian community has had such a incredible success with quashing that second wave. We've been we're kind of feeling a little bit about, well, what are those good things in a way? What are the things that we can take away and the learnings? And as we come out of lockdown, as we come back to work, as we do those things, what are those things that we can learn? So it's, whilst we would never want a pandemic, it does give us the opportunity. And as you said, when you called out the compact, it gives us the opportunity to say, well, just how big an impact did we have by doing that piece of work? Okay, there are a couple of questions here. One from Ken Harrison. Morning, Ken. Will future telehealth consultations reduce costs in the future?
It's a tricky question to answer, Ken. Yes, I think as we work more broadly to deliver services in the home, they will have a lower cost base, and they've also got the added bonus of obviously having productivity outcomes, because parents are not having to have so much time away from work and kids not having so much time away from school. But I would also say that as soon as we're always focused on where's the right place for that treatment, and we're always focused on ensuring that we are constantly challenging our thinking about that's complex now, but in a few years we'll be able to move that from perhaps a multi-day stay in an inpatient bed to a same-day stay, and a same-day stay to hospital in the home. That's kind of the chemotherapy journey we've had. But as soon as we move chemotherapy out into the home, supported by Wallaby, we've got new chemo protocols, new complexity in service delivery, new services that we then substitute in. So having bricks and mortar will always allow us to focus on delivering cutting-edge, highly complex treatments, and we will then continually support services to be pushed into the community and home where it's safe to do so, and broaden our reach. So it's a combination, I think, going forward. And yes, some of those services will be cheaper to deliver, but we'll still be focusing on delivering those complex and often expensive treatments.
Yes, yeah, indeed. So the next one, Jane, is from Joanne Fitzgerald, and you and I both know Joanne really well. Welcome, Joanne. Thanks for joining in. What will you and the hospital take forward into a more normal 2021 and beyond, and how will you build back better?
Really good question, Joanne. We are working through that at the moment. We're actually focusing on our COVID cautious plan that will help guide our decision making over the next couple of years in terms of what's provided. And a little bit is dependent on the success of a vaccine in terms of how normal we get back to. But we will be taking many things. Telehealth is just one example I've given today, but working from home and the flexibility that comes with that is another. There are so many things that we've learnt in terms of being agile and responsive and supporting quick improvement and change that we want to continue to embed so that we can speed up our innovation. We do a lot of innovation, but speeding it up is important to us so that we can continue to be leading the way. So a lot of those things will continue. We're certainly looking at how do we continue to support team cohesion across Team RCH and managing staff working from home and on site and creating that new normal, if you like.
Great, thank you. And what's fantastic about being able to do events like this is we can get some immediate feedback from Rob Miraglia as well. So I'm just going to read what Rob has to say. We manage the day-to-day issues for Luca, but the team have our back. The support we get from family and friends is also overwhelming, and through the support of the Luca Miraglia Foundation, we have the ability to support... he's going into advocating for our bed sponsorship program. Thank you, Rob, bless you. We have the ability to support the bed sponsorship program and kids like Luca. I think we've stopped typing in, so that's it. Thank you, Rob, so much for saying that. And I think, but that's the important thing, isn't it? I guess that's that first piece in response to the question about telehealth is, the family, and perhaps even Rob saying, the family is in greater control almost, but the team are there to support.
Absolutely.
Okay, I'm just realised that I need to scroll down on the iPad a couple of times, so. Right, next question is from Laura. What do you think the next 6 months look like at the RCH for the patients and for their families?
Look, Laura, we hope that we will have more patients and families back on site over the next 6 months. We're planning to certainly increase our elective surgery activity in line with government directions. But we will need to continue to have some level of restriction around the site in terms of number of visitors and access, unfortunately. So I don't think we will get back to completely normal over the next 6 months. But we are certainly looking at a range of options so that we can continue to increase on-site activity. And then obviously planning, as I alluded to earlier, hopefully to be delivering a COVID vaccine at some stage through our fantastic immunisation service, which will allow us then to take that final step back to what we would say is normal. But I actually want to say that we're going to reach for better, not for normal.
Yeah, no, absolutely. Thanks, Jane. I was just thinking actually as I was reading that out from Rob Miraglia, we saw two great examples we've got three great examples actually of how the foundation works to support not only donors but other foundations who wish to have impact. And so we've got, as I said before, Margaret Zeta on the line. So My Room have support childhood cancer right across the state, but are very, very connected to the hospital through previous experiences. We just heard from Rob about and the Luca Miraglia Foundation, where the family have set up a foundation in Luca's name, but they're still supporting the work of the hospital. And then thirdly, we saw in the little clip from Channel 7, our young patient there, I noticed he had his cap on from RCD, which is the Robert Connor Dawes Foundation. And of course, they are supportive of brain cancers because Connor passed away from that. But they are supporting work of research and clinical practice here at the campus as well. So we have a very broad church of supporters from individuals, from community fundraisers, all the way through to trusts and foundations. Of course, that's without even mentioning our Good Friday appeal, because as Jane said, we're in the middle of supporting or celebrating 150 years. But next year is 90 years of the Good Friday appeal, supporting this great institution, and then the year after, the Royal Children's Hospital Auxiliaries are going to be 100 years old. So we've got this incredible tradition, and everybody on the call and everybody in the studio and in the control room are all part of that incredible community. So sorry, I do go on, don't I? But it just really shows, I think, the importance of who and what we're trying to do. So I've got another question, Jane. Now that the numbers have stabilised in Victoria, are there new challenges as we try to find a balance between COVID safe and COVID normal?
Absolutely. And I think in some ways it's even more challenging than reducing services. Bringing services up, there are so many dependencies. And I think there's also, fantastic on the back of so many donut days in Victoria, increasing community expectation that things are back to normal. But in a health service, we still need to be COVID safe. Unfortunately, we've had many healthcare workers across the state test positive to COVID-19, and so we need to really be continuing to focus on making sure that we keep our workforce safe and our patients and families safe. And there will be, as we are reminded as from the South Australian experience this week, that there will be some virus circulating in our community. So we have to continue to be mindful of the risks associated with service delivery and keeping people safe, whilst also ensuring that we're delivering patient and family-centred care. But it does have many more moving parts when you're looking at lifting up services rather than reducing services.
Yeah, indeed. And that expectation that you were talking about before. Marg, thank you for the question. Marg Zeta's asked the question. Have you seen philanthropy suffer directly at the RCH as a result of the pandemic, given so many businesses have suffered, especially in Victoria? I'll take that one if you like. Sure. Look, I think, Margaret, we're all very mindful that people are suffering, that businesses are suffering. We're just deeply grateful for what people can, the fact that they're still with us, that all of you that are on the line are still with us. The conversations we've been having with people are that the passion for the hospital, the commitment to the hospital, none of that is different. That all remains unchanged. But perhaps we do have to pull back, or perhaps we have to delay those commitments, or perhaps we have to give a year a miss. So we're very, very respectful of that. We're just grateful for everything that people want to support. And we're also grateful, I think, that because we have such a great history, we've got a good base behind us. And so this hasn't left us in a position where we have to say to the hospital, we can't meet the commitments that we're making to you. We think we'll be able to weather that storm. But the important thing, I think, is that we have such incredible we have so much more to do. And the hospital is, that vision for the future of children's health right across the campus, whether that's in taking clinical care to the next level, like, remote virtual care, whether it's whether it's getting more and more into personalised medicine in research and how diagnostics and how treatment will transform lives, or whether it's just training and developing the best and brightest minds. Whatever those things are, we've got this vision for the next 150 years. And so we're going to continue to say to our community, we need your help. And we know that we need your help is more or less resonant when people are suffering, and we're respectful of that. But nothing ever changes from the fact that the ambition here is large, the needs are great, and we can deliver and continue to deliver great children's health and adolescent health outcomes for the next 150 years, and we all want to be a part of that. So yes, things might be a little bit, tight now, but we also welcome the opportunity to continue talking to people. So I've got a question, and this will be, I think, our last question, because I have one more that I need to ask you, that I really want to ask you. But can we have a question about staff testing positive? Now, Jane, you may or may not want, you'll answer this as you want, but can you talk about how you've supported staff during a challenging time like that?
Yes, we certainly have had some staff test positive across the pandemic, and we've also had to have staff what we call furloughed, so that when they've had a exposure to the virus in the workplace and they're at risk of getting the virus, had to go off work for 2 weeks. So we've actually worked really closely with our workplace health and safety and our people and culture team to make sure that we've supported those people through that process, ensuring that they've got leave available to them, that their health is okay, that they feel connected to work. So there's been a lot of support provided to those people that have had COVID-19, but also those that have had to have some time away from work in isolation because the risk that they may have the disease. So I think we've had a lot of emphasis on workplace health and wellbeing. I had a shot in my presentation, which I didn't call out, of the wellbeing hub that we'd made available for staff to get away from the workplace, continue to physically distance, but just breathe out. It's been a very, very stressful time, and one cannot underestimate the impact of delivering services in full PPE, having high demands. It's stressful. So it's not just those that have tested positive to COVID-19, but also our whole workforce that we've continued to look at how we support them to make sure they're looking after themselves, because if we don't look after ourselves, we're not in a position to be able to look after the children and young people that need us most.
Great, lovely answer. Thank you. So, my last question. It's not all that tough. It's an easy question, actually. It's the big question. If someone came up as a result of today's event or in the next couple of weeks and said, Jane, we'd like to give you $1 million, how would you deploy that to the greatest impact for patient and families?
I think at a broad level, it would be continuing to embrace virtual healthcare technologies, purchasing equipment so that we can assess and monitor in the home and that it directly feeds into our electronic medical record, continuing to enhance our electronic medical record, including the portal that's available to patients and families so that they can continue to partner with us to deliver that care. There's so much opportunity in terms of those virtual healthcare solutions that we really want to be taking up quickly. We've had a little bit of an insight in that today, but actually there's so many developments in terms of ICT technology that support the delivery of healthcare, and it would be great to be really able to embrace those, to get data and information from patients and families without them having to come to hospital, and our clinicians having access to that information and partnering with those families to deliver it.
It's a great vision, isn't it? It's the future. It is the future.
So, it is the future.
Yeah, thank you. Well, thanks everybody. Thank you so much for such really considered questions. And thank you, Jane, for sharing what are actually unique insights. I don't think you could hear these sort of insights anywhere else right now. So thank you so much for being with us. Ladies and gentlemen, as we said before, the hospital is 150 years old this year, and we had planned a year of amazing activities to mark the momentous occasion. But of course, sadly, we haven't been able to have those take place. We did pivot digitally. We've done some wonderful storytelling and, if not celebration, certainly storytelling about what it's meant to have this incredible institution looking after child and adolescent health since 1870. So we've been able to do that, and we thankfully we will be able to come back in 2021 to do a couple of those things that we thought we'd do this year and we thought still had some longevity. So we're going to do an anniversary dinner in June next year, and I'm really pleased to say, still going to be able to deliver the RCH 150 anniversary art trail called Me and You. So both of those you can be part of. So I hope today has shown that, thanks to your support, we've come through this year stronger than ever. I think that's the main message. There's lots still to do, but we are coming through it stronger than ever. You are all ensuring that the RCH remains at the forefront of child and adolescent healthcare. And what you've heard today, I think, really resonates to say that you're actually very meaningful to our families. I hope we can count on you to continue making that real difference to the lives of children and young people as we embark on our next 150 years. There are so many ways that you can get involved with us. I think everybody on the call knows that. But you can join Luca and his family in sponsoring a bed that can have an impact on an area of the hospital. And I can even say, we actually have bed sponsors in our Wallaby ward, which is really amazing. The Islamic Council of Victoria joined us in an incredible program to sponsor our virtual beds. So we're very creative here, folks. We can make your passion come to life in any way that you can think about. You could also get your friends and family together to walk or run or skip or cycle along the incredible anniversary art trail that we're going to see throughout Melbourne, Port Phillip, Moonee Valley, Stonington and down in Geelong. And you could do that and raise funds for us whilst on the art trail. We're happy to take you through great ways that you could do that. Or perhaps you'd like to know more about our groundbreaking research programs, our exceptional clinical care, or the latest equipment that the hospital desperately needs. All of this can only be possible through philanthropy, and we really invite you to join us on that journey. So there are a great many ways that you can help the patients and the families here at the hospital. So please contact our foundation team or myself about contributing to in a way that is meaningful for you, because that's what we're about, is we want to turn your passion for childhood health into something that is meaningful for you. We would be honoured to speak to you about that. So that brings us to the end of today's event. I want to thank you again so very much for your support of the hospital. We would typically have been meeting, of course, wouldn't we, around this time and saying thanks in person. And whilst we can't do that, we do want to make these things happen so that you know that we are deeply grateful to you. So Jane and I would like to leave you with one final message from Matt Sabin, who is the Chief Medical Officer at the Royal Children's Hospital. He wanted to extend his sincerest thanks to all of you. So we're going to hear from Matt. Thank you, ladies and gentlemen. Have a wonderful festive break, a great holiday season and Christmas. Look after yourselves. Stay safe, keep washing your hands and keep staying physically distanced. Bye-bye.
Hi, my name's Matt Sabin. I'm the Chief Medical Officer here at the Royal Children's Hospital. I'm absolutely delighted for this opportunity to say thank you to you, our supporters, for keeping the hospital front of mind during these unprecedented times. There's no doubt that this year has been a very challenging one, but knowing the community is behind us and continuing to support the hospital has been a great motivator for all of us. Your generosity and energy have enabled us to respond quickly to priorities that have emerged as a result of COVID-19. As you've heard today, while much has shifted over the past year, our commitment to providing the best care to every young person and family who needs it has not wavered. What has always been important to us is what remains important to us, that is, delivering a gold standard quality of care to our patients. And we're able to do this because of the generous support that you provide. On behalf of the Royal Children's Hospital and the wider Melbourne Children's Campus, please accept our sincere thanks for your ongoing fundraising and philanthropic commitment. It's ensured that the RCH remains a safe place for children and families in need of our care during the turbulent months of lockdown in Melbourne. I look forward to thanking you in person when it's safe to do so, and until we meet again, please keep well and stay safe.